Good afternoon, everyone. My name is Maya Luria with TMC for Seniors, and we are continuing on with our Heart Month. And today we're going to be talking about reducing heart risks. Prevention is key. I have Dr. Basel Skeif here with me. He is a cardiovascular and pulmonary disease specialist in Tucson, Arizona, over here at TMC Health. And he has over 25 years of experience in the medical field. Welcome, Dr. Skeif. How are you today?
Very good. How are you?
Good, thank you. It's the first time that we've had you here. I'm so glad you could make it. Sure. I'm going to go ahead and put your PowerPoint up. You do have an online audience that's watching here today. So if you're watching from home and you have a question, please feel free to put those into the chat and I will ask Dr. Skeif afterwards. I'll turn it over to you, Dr. Skeif.
Okay. So I'm in cardiovascular disease, not pulmonary disease, only cardiovascular. So good afternoon, everybody. And today we're going to talk about reducing heart risk, and the key is prevention. So why cardiovascular disease matters? It matters because 1 out of almost every 3 deaths is related to cardiovascular disease. And when I say cardiovascular, it's not just like the heart, it's the heart, the brain, like, any vessels, the blood vessel goes everywhere. So stroke is the cardiovascular disease. Blockage in the legs are cardiovascular disease, and they are all connected, and treating one is treating all of them together. Most of these events are preventable. There's things you could do to make your risk as low as possible. What I'm going to talk about today, few different diseases. There is a lot of cardiovascular things, but in general, we're going to talk about coronary artery disease when people have a heart attack or blockage in the artery, heart failure. From the arrhythmias, I'm going to talk only about one of them, atrial fibrillation. There's so many things other than that. And valvular heart disease, when the valve in the heart doesn't work very well. And as I said, stroke and peripheral arterial disease are part of it. It's the same like coronary disease, it's just different area of the body. In general, the heart anatomy is the heart is a muscle which squeezes the blood, so it goes through the let's see if I can move this one here, through the arteries to all your body, and the blood comes back to the heart muscle. In addition to that, there is this small, tiny blood vessels, not too tiny, but small. You can see them right here on the heart itself. The red one are the arteries which give the blood to the heart. When you have a blockage there, this is where people have a heart attack. There is valves inside the heart. They open and close to allow the blood to go only in one direction, so the pump is efficient. And there is electrical system which make the heart pump in a regular pattern. Any dysfunction of those will cause heart disease. Coronary artery disease and other vascular disease, if the blood vessel blockage happen in the heart, you get a heart issue. If it's happening in the brain, you get a stroke. If it's happened in the kidney, you get kidney failure. In the legs, people have claudication, they have pain in their legs. And the vascular disease, the arterial disease in general, it is a plaque accumulation. And as you can see on the graph, the first blood vessel is a normal young kid, and then you can start to build up plaque. And the very last one is when there's a clot in there, there's a plaque rupture, and this one people have a heart attack. You have the area below it where it's getting the blood supply from that blood vessel, and the heart muscle it dies or get severely damaged, and this is what is a heart attack basically. Congestive heart failure is just, there's many different types of congestive heart failure or heart failure. One of them is the heart muscle become very weak, and you can see in this picture here, the one on the right, the heart is dilated, like enlarged, and it doesn't squeeze enough. That's systolic heart failure. Diastolic heart failure is when the heart doesn't relaxes very well, and that's more common actually, and it's common the older you get and the more high blood pressure you have, and when the heart doesn't relax, it doesn't function properly. Other types, there's many types, but other types is like the valves in the heart doesn't function. Now the heart is still strong, but the blood is going in the wrong direction. That's valvular heart disease. Some of them are preventable, some of them are not, but a lot of them are preventable by preventing the cause for the problem. Valvular heart disease, which I mentioned before. So the valves, when the heart squeezes, these valves will open and close to allow the blood to go in one direction, not to come back. If the valve doesn't open very well, this is narrowing in the valve, stenosis, and not enough blood going out of the heart. If the valve doesn't close very well, the heart will leak back and has to be pumped again. So the pump is inefficient, and people will have shortness of breath and other symptoms of heart failure. Atrial fibrillation there is a lot of arrhythmia in the heart, and the heart has a very specific pattern of how the pulse generated in the top of the heart and goes down all the way to the lower part of the heart. Any disruption in that will cause some type of arrhythmia. Atrial fibrillation is one of them. If you could see here, the one on the right, the electricity is not going in the right pattern, and it's kind of chaos type of electricity, and that's what AFib. The heart is kind of fibrillating on the top chamber. It's not squeezing very well at that part. Clots will form, and that clot will go to a different part of the body, and people will have a stroke. And that's why there is a very high risk of stroke with AFib. And AFib also is something which could be, to some degree, preventable with treating the risk factors. The biggest risk factor for AFib is age, which you cannot change, but high blood pressure is big risk factors, and that treatable. Coronary artery disease is a risk factor, which also treatable. Why I put this this piece here about human lifespan, because people always tell me I want to do it the natural way. And if you could look at this, starting with like about 100,000 years ago here, human life expectancy was very low, in the 30s, low 30s. Why? Because they get sick very easily from anything. Like, if you get appendicitis, you're dead. There is no like surgeries. Animals will eat them. There is no food. And you keep going all the way to like 200 years ago, when slightly start to see improvement in life expectancy due to like clean water, and people living in houses, they are not being eaten, but still life expectancy was like lower than 50. We didn't get to this current life expectancy till our medicine become much more modern, and that's related to vaccines and related to surgeries we do when people have some type of like appendicitis, for example, and due to medication which improve life expectancy, control blood pressure, cholesterol, and other things. So natural way is really not sufficient, and you've got to do stuff which we do in this era to live longer. Natural history of coronary artery disease. Coronary artery disease doesn't start when you have your first heart attack. Coronary artery disease starts long before, in the age of 14, 15. You could see on the second one from the left, somebody in their 20s or even like 15, 16, they start to have some plaque buildup. It's very little. Slowly, it gets more, and in the end, it block the artery or rupture, and you get a heart attack. But the problem started very early, so the treatment really, or prevention, has to start very early. What are the risk factors for coronary artery disease? And there are also risk factors for the other heart problem. High blood pressure or hypertension is a very big risk factors for coronary artery disease, for heart failure, for kidney failure, for stroke. High cholesterol, which lipids in general, like triglyceride, but LDL cholesterol is a risk factors. Diabetes is a very big risk factor. Any increased sugar in the blood, it increases the risk of having all this, what I mentioned before. Smoking is a very big risk factor. Lack of activity. People who exercise more, they have much less chance of dying than people who do not do anything or like completely like immobile. Poor diet, which I'm talking about here, diet which is not healthy diet which like full with fried food or carbohydrates, like especially simple carbohydrates or refined sugars. Also a risk factor for coronary artery disease. Family history is risk factors, not much you could do about that. And age is also a risk factors, which also you cannot do much about that. But the other factors above it is all modifiable. You could make a huge impact with doing something about them. Evaluation of coronary artery plaque. I mean, there's a lot of ways you can go and look at the plaque, but some of the stuff which easily accessible is coronary calcium score, which tells you if you have calcification in the arteries, which could also say that there's a plaque. Having normal coronary calcium score doesn't mean there is no plaque, but it's kind of one of the indicator. Ultrasound, simple ultrasound of the carotids could show you how much plaque there is in the body, because they are similar. The carotid similar to the one in the heart, similar to one in the brain, to one in the kidneys. So ultrasound, there is more advanced stuff to look at, but those are a simple, easy, way to check for coronary plaque or plaque in the arteries in your body. Let's talk about prevention and diet. Diet is a very essential part of how to prevent cardiovascular disease. Shifting from our typical diet currently, what we have in general, to a like Mediterranean diet early in life will increase life expectancy 10 to 13 years. And I'm saying early, it means, you've got to start early in life to have the biggest effect. It decreases 20% the risk of mortality. Making these changes at the age of 40, you get 11 years of life expectancy longer. At the age of 60, 8 to 9 years. Even at the age of 80, there's a 3 years of increased life expectancy by changing diet. It's very impactful. There's nothing as impactful as this. It's hard. I mean, I haven't seen too many people change their diet dramatically, but it is impactful if you can do it. What I'm talking about diet, like what is a good diet, is basically Mediterranean style diet, which is fresh food, whole grains, legumes, nuts, fruits, vegetables. What to avoid is basically trans fat, like any fried oil. It become saturated, is no longer a good oil. So if you fry with your oil, even if it was like olive oil, is no longer good when you heat it. That's trans fat. Excessive saturated fat. I'm not saying don't eat meat, but don't eat excessive amount of fatty meat. Coconut oil and palm oil. Dairy in very big amount. It also could will increase your cholesterol. Processed meat in general are not advisable. All added sugar is not good. Refined sugar, refined carbs, excessive sodium, all these stuff are not good for you. And anything actually packaged, been sitting in somewhere for a long time coming to you, it's not fresh, it's processed and has a lot of stuff which is not good for you. So avoid them. It's not easy, obviously. That's why I said diet is not very easy to modulate. Exercise. Exercise is not like excessive exercise. You don't have to go like run 5 hours a day. It's really half an hour every day, 5 days a week. That's taking a walk every day, half an hour, 5 days a week. It will add 2 to 4 probably years of life starting early. Is very impactful. It will decrease the risk of all-cause mortality, mean like dying from anything, 20 to 30%. It's not only going to decrease your risk from heart attack or stroke. It's also improve the joints and most people actually, their limitation after a certain age is more than their heart, is actually their joint, their hip, their knee. This is what I see patients really kind of becoming limited in what they could do. And it's a vicious cycle. You have knee pain, you don't do much, and you don't do much, you have knee pain. Some health predictors of how good you are. VO2 max, some of you might have heard of that. It's the ability of the body to extract oxygen from the blood. And the more the body is able to get the oxygen out, the healthier that person. It's have to do with muscles, blood vessel, heart. It's like everything in your body working together. The higher that VO2 max, the more healthy the person is, and the lower it is, the less healthy the person is. And somebody with low VO2 max have 2 to 5 times the risk of early death. And it could be measured either in a lab with like mask, or it could be measured by like walking and counting, how in 12 minutes, how much you were able to distance to pass. And that's, you can put it in certain like, equation. You can tell what is your VO2 max. Um, it's all known, even in the past 10, 20 years before this VO2 max came, we knew that people who could exercise more, no matter how their heart look like or their artery look like, they will live longer, period. Another, predictors, I just put this, there is other predictors, but I just put some stuff because they are interesting. Reaction time, like if this is falling and I caught it, the faster you could do that and you are able to do it, this is indicator of good health, because it's not only your cardiovascular system, the muscle, the brain, the eyes, everything together. So it's a nice predictor also for all-cause mortality. Blood pressure. So blood pressure is a high risk for so many cardiovascular diseases: stroke, heart attack, kidney failure, and is very easy to be treated. So it's one of the stuff which should always be treated. Every 10 millimeter decrease in the blood pressure, if it's abnormal, let's say you're going from 150 to 140, only 10 millimeter will lower risk of major cardiovascular event by 20%. Will decrease all-cause mortality 10 to 15%, only 10. So if somebody is 160, bring them down to 130, not even to 120. This is like a huge amount of benefit you get. Blood pressure is a very bad risk factor. The goal for blood pressure in general, less than 130/80, is not the same for everyone. Older people, usually I don't get them too low because they start to get dizzy. So it's age related. But if somebody come to me is like 45 years old, I want it to be below 130/80. How do we treat blood pressure? Diet, like low sodium diet, will help treating blood pressure, and weight loss. For blood pressure, weight loss works very well. It doesn't work for everything, but it works for blood pressure. You lose considerable amount of weight, blood pressure will go down. Always diet and exercise is the way to start. But eventually, if somebody's starting with 160 over, let's say, 90 blood pressure is not going to be enough, you're going to need medications. There is a lot of different medications. Some of them are much less chance of having side effects. Some of them are more. It depends. Everybody is different. There is not one medication going to work for everybody. And it depends where we start, the starting point. If somebody's starting, let's say, with 150, 160, they're going to need more than one medication, because everyone decreases you by 10 to 15 points. So starting high, you're going to need more medication. If you're starting close to the target, you might get away with one medication. But the goal in the end of the day is not how many medications. The goal is to get the blood pressure to the target range. Cholesterol also is an important risk factor for plaque buildup in the heart, in the brain, everywhere. So risk of stroke, risk of heart attack is higher the higher the cholesterol is. And what we look mainly at currently is the LDL cholesterol, because that's the only thing currently we could treat. There is new stuff coming in the future, but for now. And you could see here from the slide, only 10 milligram of decrease in the LDL cholesterol give you 5 to 6% decrease in the risk. When you go to more than 100 milligram reduction, the risk will go less than 50, more than 50 risk reduction. The way we think about it, and the cholesterol numbers, when we start to get to below 100, the buildup of plaque slows down significantly. When you get below 70 or below 55, it might even completely stop, and in some cases it might regress a little bit. So, the decrease, we don't know if there's a limit where that's it, don't decrease anymore. You just keep on going as much as you can. The bottom line with cholesterol, 40 milligram per deciliter of reduction decreased cardiovascular risk 20 to 25%.
Could you repeat that, please?
Every 40 milligram decrease in the LDL cholesterol decrease the risk by 20 to 25%, the cardiovascular risk. The important thing here about it is the higher risk the person is, the more benefit they get. The more cholesterol reduction, the lower the number we get, the more benefit you get. And the duration, like starting early, is give you more benefit. So as you can see from the slide, a couple of slides before, cholesterol buildup start in teenage years. So treating cholesterol not by medication first, by changing lifestyle, should start early, because this is when the buildup. Once we are 70, 80, 90, we get something. It's already there. I mean, you could make it better, but you won't get the same benefit than if you start early in life. But any point you start is better than not starting. And as I said before, there is no proven safety threshold for how low you could go. You could go low. I've never seen people, because the cholesterol decreased significantly, they have any problem with that. As I said, cholesterol reduction, you start with diet and exercise. Diet and exercise for LDL cholesterol doesn't work that well. Most of the cholesterol your body makes. So it will go down maybe 5-10%. The HDL might go up by 5%, 10% maybe, but it won't go that low. If somebody's starting with cholesterol 160 and the target is 55, you could do all the diet. I mean, it's going to get to 140. You're not going to be able to get to a target of like 55 if somebody has coronary artery disease. You need more than a diet and exercise. But of course, diet and exercise need to be done no matter what, because it has other benefits besides the cholesterol. Medications which work for the cholesterol, there are many. The most impactful one is statins and PCSK9 inhibitors. Statin is a pill. PCSK9 inhibitors are injection, but now there's a pill form of it too. Statins, the strongest one, get you down by about 40 to 50%, and the injection, the PCSK9 inhibitors, get you down by about 50 to 60%. And if somebody starting, let's say, with LDL of 160, and my target for them is below 155, I know they're going to need 2 or 3 medications. If the starting point is 110, you might be able to get with one medicine. But if the numbers where we're starting is higher, you're probably you're looking for multi agents to be able to get the cholesterol in the right place. And a lot of talks about statins, and in the truth, there is recent studies said that most of the bad reps or bad symptoms people talk about is not really as it been people talked about, like it decreases your mental acuity. There's nothing like that. That's not true. So it's safe. It's much safer than people thought before. I put thousands of people over the years on these medication, and rarely I had to stop them because something really bothering them or something really happening. Diabetes is a very big risk factor for plaque and for heart failure, for coronary artery disease and heart failure. Increased sugar in the blood is not good. Any increase in the sugar from the normal is not good, even if it's not in the diabetic range. Decreasing the hemoglobin A1C, this is how we measure diabetes. When we go above 6.5 is diabetes. When we go above 5.5, it depends on the lab, is a pre-diabetes. So once people above 6.5, they are diabetic. And any 1 point decrease in the hemoglobin A1C, it will give a major improvement in outcome. And that outcome from like retinopathy, when people don't see anymore, to like heart attack, to even all-cause mortality. 1 point will decrease all-cause mortality 10 to 15%. So people will, like I see people like coming with hemoglobin A1C of 12. I mean, imagine this go from 12 to 7. I mean, 5 point will decrease their risk only by doing one thing dramatically. And it is very undertreated disease. I see it all the time for a variety of reasons. Diabetes management. Diet works very well for diabetes, and weight loss works very well for diabetes. So definitely treating diabetes should start with diet and exercise and losing weight. Even people who change their diet from to something very low carb intakes, and they did not lose weight, you will see that hemoglobin A1C went down. Even the weight did not go down. the best medication to use for diabetes nowadays, there is the medication, what we call them, they have a protective, cardiovascular protective effect. And those are Farxiga and Jardiance, for example. They make you pea sugar, so it doesn't work directly with the insulin, and this is very good medication if you can tolerate them, of course. And the other ones are the GLP-1s, so you guys heard about them, they are used for weight loss, but they are also excellent for diabetes. These two family of medication have shown significant reduction in heart issues for people with diabetes, even people without diabetes, but they work very well. Even we use them for heart failure. We use them for sleep apnea, for a variety of different things. Tobacco, there is no safe level of tobacco. And it is very significant risk factors. It increases the risk of coronary disease 40 to 50%. The same with stroke, it increased the risk of stroke to like 30%. Smokers die 10 years earlier than non-smokers. And this has been this kind of information been around for a long time. So if somebody smokes, this probably more important than anything else to do. Like if you want to do anything, stop smoking and then look at the other risk factors. We get the biggest value for intervention is stop smoking. Supplements, people always ask me about that. Very few supplements have a value for cardiac protection. In general, they don't work. Supplements work for stuff like vitamin D and calcium. They work for the bones. Out of this, really, there's nothing works for decreasing risk. That's the sad truth, but people always ask me about a bag of things. Yes, please. You want me to just? I'm almost done, and then you can ask me questions. So the key takeaway here is most of heart problems are preventable. Fewer of them are not. Valve disease, which happened because of age, just wear and tear in the valve, might not be preventable, but there's ways to fix it nowadays. But most of other stuff are preventable. And the key here is to start as early as you can. And there is no now it's too late to start. There is no too late to start. And that's it.
We'll do online questions
Okay.
first, and then we'll do it.
And then we'll take your questions. Yeah, go ahead.
Yeah, thank you, Dr. Skeif. I did have some questions that came in. One was, are there certain food triggers to AFib? They thought maybe they'd heard red wine might be a trigger.
Alcohol, not red wine. Alcohol has nothing to do with red or white. The biggest trigger, food trigger for AFib, is alcohol, and it goes it depends. One glass of wine or any drink, it is less than 2 glasses, less than 3. The more you have, the more likely you're going to go into AFib. I'm talking about people who go in and out of AFib, right? I mean, if they are already in AFib, doesn't really matter. But if they are coming in and out, the more alcohol, the more likely you're going to have an episode of atrial fibrillation. It's very correlated together.
Great. Are there other foods that are triggers besides alcohol?
Maybe excessive caffeine, but I'm talking about very excessive. Regular level of caffeine really never proven to be a problem. People ask all this question all the time. No, 2 cups of coffee a day doesn't cause a problem.
Okay.
So no food in general, other than alcohol. No, I mean some stuff. Let's say salt or whatever increase your blood pressure will trigger it via making your blood pressure higher, because blood pressure is a big risk factor for AFib. So yes, salty meals might not be helpful.
Okay. And is it all alcohols, or it's not just wine? Is that right? Is it all alcohol?
Yes.
Doesn't matter what it is.
It is the alcohol component, not how you.
Okay.
Yeah.
Okay, great.
Yeah.
I had another question regarding the blood pressure.
Yes.
Did you mention 130/80, or they thought it was supposed to be 120/80? What's the recommendation?
Well, normal is 120/80, but we don't treat 120 like 7. So the target is when somebody has high blood pressures to treat them, to get them below the 130. And it depends on the age. If I have like, 21-year-old person, I want them to be 110 over 70. If I have an 80-year-old person, if I get them to 110 over 70, they will be like walking around unbalanced. They will fall, they break their hip, and they die. And it happens. This is actually why in like the European guidelines different than the US guideline, and says it gives you different level for blood pressure control in older people. And the reason for it, there is a curve. When you start to go below that curve, you start to get dizzy and people will fall and break their hip. The same with sugar. You want to lower it, you don't want to lower it too much. You lower it too much, you get like, a complication from very low sugar, which is very severe. So you have to decide like, who is this patient? What is the target for that specific person? Not everybody is the same.
So individualized, obviously.
Individualized, yes. I mean, there is no one size fits all for sure.
Right. Okay. How much dairy is too much dairy? Was another question that came in.
I don't know the answer, but dairy, what I thought, a low-fat dairy is probably preferable to like full-fat dairy, especially when you get older. I'm not talking about kids. Kids, it's a different story. They need all the stuff we kind of say no, but it's hard to tell you how much. I don't know, and everybody is different. I have people who cut significantly on dairy intake. They eat cheese every single day, and I saw with that person very good decrease in their cholesterol. I rarely see it because, again, cholesterol in general doesn't respond much to diet. It is produced by the body, and that's why diet is not that effective for cholesterol. It's effective for blood pressure, it's effective for diabetes, but less for cholesterol. So yeah, cut down on the dairy. In general, what I say to people, eat in moderation. I mean, there is nothing don't eat. I mean, some people go crazy with the diet. Don't go crazy, eat in moderation. You can eat anything you want, but don't overdo it.
Okay, so moderation is key.
Absolutely.
If high cholesterol is genetic, how much of an impact does exercise and a healthy diet have?
10%.
10%. Okay.
On the cholesterol number.
Okay. All right.
That's why I said cholesterol probably going to end up getting medications, because you could decrease it by about, most people, I mean, I've seen people decrease it more than that, but most people will go down 10%, but that's about what you can get from diet and exercise. Okay. And it's both like decreasing LDL and increasing HDL, which HDL is a good one. You want it to be higher.
Great.
But the diet is very effective on triglycerides.
Okay.
Like if somebody has high triglycerides, I don't put them on medication because they don't decrease risk of having a heart attack, triglyceride medication. These patients, I told them, diet is the main thing. And the diet here is actually low carbs. Low carbs will decrease the triglycerides. So for that, I would say diet, not medication.
Okay. How do GLP-1s impact heart health?
It's actually very impactful, because even with people who don't have diabetes and they have obesity, GLP-1 will improve their cardiovascular health. Think about it this way. I mean, obesity, I didn't put it as a risk factor, but obesity brings so many things with it, right? It makes you have more hip pain, knee pain, you do less. You're breathing heavier, you have sleep apnea from it. It brings diabetes, it brings high blood pressure. So people do very poorly with the high weight. And you're decreasing that weight. Some people do not need that many blood pressure medication. They might not need that many other sugar medications. Their knee pain improve, their ability to exercise improve. It changed people's life. It improve risk dramatically. It's not for somebody who have 5 pounds more to take. I mean, I see it all the time. It's really for significant weight, and you take it, you lose good amount. If you can tolerate it, of course, a lot of people might not tolerate it. There's a lot of potential side effects, but the risk of not taking it if you have uncontrolled diabetes, high blood pressure, weight, affecting your joints, versus taking it even with like the risk, it's worth the risk for a certain patient. And it's not for everybody. You've got to be the right person for the right medication.
Right. Okay. That was all the questions I had. I do want to just clarify. So you are working at TMC Health at the Rincon campus. Is that correct? For inpatient? Is that
Inpatient
right?
only. I don't see patients anymore. I used to.
So, but just so people know, that's where you're at. You're over at our Rincon campus. So if you are inpatient there, they may see you at that point.
Hopefully they won't need to be inpatient there.
Right. Exactly. Yes. I want to.
It's a great place. I don't want them to be inpatient anyway.
I get it. Yes. I want to thank you so much, Dr. Skeif. I'm going to wrap up with our online audience, and I'm going to turn it over to you for any questions in person. Thank you so much for being here.
Sure.
Thanks again for joining us today. We hope you'll come back. We are going to be doing, actually next week is our Heart Smart Expo. That is on Wednesday, February 18th. From 11 a.m. to 1 p.m. It is only an in-person event with there's some screenings that are going on. There's a cholesterol and glucose check, blood pressure checks as well, along with several other exhibitors. If you're interested in attending that, there are a few spots left. Please give us a call. Our phone number is 520-324-1960, and we can help to get you registered. That is the Heart Smart Expo on Wednesday, February 18th from 11 a.m. to 1. We will see you again soon, and that one is only in person. Thank you.